Let me give you a warm welcome on our industry workshop. We are the physios from Poland. We are going to talk about ICF in clinical practice. So let me shortly introduce our team. This is Veronica. Veronica speaks 4 languages. So don't hesitate to ask because we speak 4 languages. Next to Veronica stands Ernest. And Ernest knows everything about technical issues of the subject I will talk about. He also knows a lot about machine learning. I know machine learning sounds interesting. And right here is Zbigniew. Zbigniew actually did the work to bring the theory of ICF into the practice. And me, I'm the person who tries to bring the physiotherapy knowledge to bright audience. So, from what country am I?
Okay, thank you, Joanna, for this nice introduction. Okay, so let's start. So, as you can see on the map behind me, we are from Poland, and we represent the Polish Chamber of Physiotherapists. Who we are exactly and what are we doing, I will tell you just in a few seconds. But taking advantage on the fact that we are on such an international arena, on such an international event, we would like to convey some maybe not that obvious facts about Poland. There's not that much time to talk about everything, so if you would like to know more, just come and visit us and talk with us. But here is something interesting. On the left downside, you can see the Academy of Physical Education in Warsaw, where is one of the oldest rehabilitation departments in Europe, and we are all of the graduates from this university. Okay, so going back to the topic, who we are the youngest professional governing organization in Poland. So we exist for less than 3 years, but at the same time, we are the youngest professional group. So physiotherapists in Poland are the youngest medical profession. As you can see, the average age of physician is 52, of nurses 51, and the average age of physiotherapists in Poland is 36. What is quite impressive, we represent over 61,000 physiotherapists from Poland. Okay, so as I already mentioned, there are over 61,000 physiotherapists in Poland, of whom 65% have a master's degree, and we also have almost 1,000 with a doctorate. Okay, so who we are, what is the Polish Chamber of Physiotherapists? Is a professional organization, a governing organization that represents all physiotherapists in Poland and is responsible for the profession of physiotherapy. That means that we act as a competent authority in Poland for the profession, and of course we place priority on the patient's safety. We do represent over 61,000, so we are young and we are creative, we have many ideas, and we just love challenges. And one of the challenges that we have recently taken on is the reform of the rehabilitation system in Poland. But more about it, will tell Ernest.
Thank you, Veronica. So, what about the reform? Actually, the reform of rehabilitation is one of most important tasks for our chamber. Basically, the reform based on the 3 milestones. The first one is connected to changes in the statement, settlements, and reporting system of the national healthcare system. The second one is the supporting of development and research projects. And the third one, actually, which is the topic of our presentation, is ICF implementation to the daily practice of physiotherapy. Simply, we can say the Polish Chamber of Physiotherapy has adopted the latest WHO recommendation to measure and collect data about the functioning as a third factor of third indication in the healthcare system.
So every one of us probably heard something about ICF. So the most common news about ICF the knowledge about ICF, that this is created to have common language. And of course, I want to be understood by the doctor. Doctor wants to understand the nurse. Nurse wants to understand the psychologist, and so on and so on. But this is not just the language between the medical professions. This is also language between the researchers, between the policymakers. This is common language all around the world. So the outcome of this is understanding countries between countries. We want to have common language between countries and between policymakers in different countries. So in ICF, we have this possibility to code all the patient state in international numbers. So what this basically means? It means that I can describe the patient condition, and not just in the meaning of disability, but also in the meaning of whole human being, because we are talking about whole human persons. And let's say, you probably have seen this many, many times. Who saw this before? I'm sure everybody. But what does it mean? What does it mean for me? It means that me, as a person, I have some structures, and my structures, like joints, like muscles, like ligaments, they allow me to perform activities. And activities means, for example, I can squat. But what does it mean in the participation level? It means that, for example, I can go and do some gardening, right? I can just, I don't know, plant some flowers. But you know what? I won't do any of these things if I don't have a garden. So these environmental factors have to be included in all assessment of the person. And I will tell you something in a secret. I do have a garden, but I don't do gardening. Why? I hate it. And almost all these things, we can code in numbers. And we have special person about the coding.
Hello, my name is Zbigniew Zibi, easier. So I'm supposed to tell about coding. Actually, the coding is slightly difficult because it means that we have to write some numbers. And technically, as a physios, maybe we are not often the best in numbers, but we can code functions, body structures, activities, and participations are, as Asia already told you, and some environmental factors. So this is the typical chart we do every day, yes? I rather no. So when we see something like this, usually we are quite afraid. And so many numbers. So nobody understands actually how to use it and how to make it useful. How to make ICF really usable in normal daily practice. So how we can code the patient, how can it look like, for example? So imagine we have a diagnosis from doctor, yeah? To be honest, if you are a physios, diagnosis from doctor are sometimes useful, sometimes are not that much useful. Because as we know, we are working more on less on the structure, but more on the function and activities of the patients. But we can imagine that diagnosis is subluxation and dislocation of the knee, so probably patient has a knee problem, and we can expect some problems in activities combined with gait and activities with the lower limb. So there are some codes. Nice codes. Yeah, you can try to read it. Yeah. Overall, all of them are connected with the problems with walking. Here we have some restriction in performance of walking. So just this is the problem with walking. As you can see, next nice code. Severe changes in the structure, edema of the knee. So we can expect that, there is edema after injury, and then because of that, maybe this walking is also somehow compromised. And of course, severe instability of a single joint. Maybe there was a ligament injury. This we don't know exactly, but we can expect maybe. So actually, we think that we don't know exactly how to code, because coding takes time. If we really would do it like every day, probably we would learn a couple, maybe 50, maybe 60 codes, and we would be able to do it more precisely. But we think that this is not the best thing this is not the best way to use ICF. And ICF has almost 20 years, so it's a little bit like a Walkman, you know. It's quite old. You know, do you know what's a Walkman? In the 80s, it was a thing which gives you music, you know. I am old enough to remember it. Younger people may don't know what's a Walkman. Yeah, but right now we have music on the phone. So the work on ICF started in the 80s, and, you know, 2001 they started promoting ICF. The next 20 years, nobody is still really using it. So we think the ICF is an excellent tool for documentation of the patient, but we should ask ourselves why it doesn't exist in a clinical practice, why it is not so commonly used in a clinical practice.
So let's back just for the moment to the ICF model. But this time, look at it as a practitioner. So what we can see, in my opinion, the most important thing which we can see it is the activity and participation. It's a much more important thing for the patients, of course. But look for the activities and that participation for the moment, on the few seconds, and look at the top of the model. We can see the orders and disease. So, do we really have influence for the disease as a physio? Can try to imagine the patient after the stroke coming to my practice, and I try to do the best with my treatments, but after the treatments, even it's the best treatment in my own practice. And after then, the patient is still stroke patient. I can change nothing in this diagnosis. Or do you know what I mean? So, or another patient with the replacement of the joint. Doesn't matter, it's the hip or the knee joint. If they come to me and I do the treatment, I even wish that after the treatment, the patient will still with the replacement of joint. Yeah? So that's why I think we have not so much influence on the disease. So look at that, just right, moment, right side. On the right side, there we have a structure and function. So what about that? Actually, this is the basic work of physiotherapy. Muscle strength, range of motions, and so on. But the question is, this is really important for the patients? I don't think so. Patients need the activity improvement. For them, it's really important how to get from here to there. They don't care what is the angle, co-angle in this knee. They want to reach that point. Or another examples, the coming down the stairs or climbing up, take care, and other activities. That is important for the patients. But of course, we are focusing in our treatment on the structures and function. And important thing is to switch on our results to activity level. So what more about the activity? We can measure activity. Activity are simply to measure and simply to compare. Of course, patients are different. Have you seen the patient with a stroke or polytrauma? But the activity is exactly the same. Exactly the same way you can describe it and can measure. So that's why we are focused on the activity level in our guidelines for the physiotherapy. We are preparing quite clear and easy to use guidelines for the physios, which describing that functional examination, treatment, and test. What is important is easy to use, and all physiotherapists in Poland start doing in the same way this examination and describing. So, what more? Of course, all tested and information are coded. What does it mean? We can compare not only results to results, patients to patients, we can compare the data.
And you may ask, why do we want to do it? Why do we want to use these books? Why do we want to use these activity guidelines, how to test it? And of course, I want to test my work before the therapy. I want to test what I've done with my patient. After the therapy, I want to measure all these things. But my main interest is to do clinical reasoning. So I want to be reliable. I want to bring this whole theory actually into the practice. And if you look on ICF, it's the best tool to do it. It's easy. You can do it everywhere. You can do it in all countries, all around the world. It's user-friendly. So, but how to bring these numbers into the practice?
So, what is the solution? When, on the one side, we have the ICF coding, so many numbers, so many codes, and on the other side, we have the clinical practice, and we as physiotherapists have a patient in front of us. So how to actually do it? Do we know how to encode the patient and how to decode the patient? So we are in our rehabilitation unit, we have a patient, and we should know how to do it. And all of the numbers should be in our brain, actually. Is it possible? Not that much, I think. So what is exactly the solution? We would like to introduce you the software that is on the way. That is going to be an app that actually automatically overrides the ICF codes on the physiotherapist's examination. And we would like to tell you also that we probably are the first country, Poland is the first country to introduce such a system-wide approach for documenting patients, ICF-based, which is quite new and we are very proud of it. The main goal is, of course, the patient and the rehabilitation team communication. So we would like to integrate all of the rehabilitation professionals in the system to make the communication much more smoother and much more easier. What are the other benefits? Of course, the therapy effects monitoring, of course, leading and managing rehabilitation unit. So there are plenty of benefits, but the main goal is, of course, the rehabilitation team communication, because we have physiotherapists, but we also have psychologists, neuropsychologists, speech therapists, occupational therapists. It's a big medical group, and we want to integrate them all. So the benefits of the system, as you can see in the presentations, are here. Of course, there are plenty of additional things like mobile solutions, voice recognizing, and many useful functions. Data aggregation, big data analysis, and machine learning are it's just a tiny part of all of the benefits that the software will bring.
So thank you very much, and we will invite you our stand on the G12 to visit us and for more questions and answers. You're welcome.